Racist doctor denies service to Snoop Dogg, but what happened next shocked everyone. The waiting room was quiet, except for the low hum of the fluorescent lights overhead. Snoop Dogg, the legendary rapper, sat in the corner, his sunglasses perched on his nose and his signature gold chain hanging around his neck. Despite his fame, the environment of the doctor's office was no different from any other. He had been to countless appointments over the years, dealing with the routine health checks, but this one felt different. Something in the air wasn't right. He had scheduled an appointment with Dr. Gregory Jensen, a highly recommended physician known for his expertise in cardiology. Snoop had been feeling a little off lately, and it was important to make sure everything was in order. He didn't often visit doctors, preferring to stay healthy through his lifestyle, but when he felt something wasn't quite right, he knew it was time to take action. As he waited for his name to be called, he couldn't help but feel the stares of others in the waiting room. It wasn't unusual for him to be recognized, but this time, something felt different. The receptionist, a young woman in her mid-20s, barely glanced at him as she typed on her computer. She didn't acknowledge his presence with the usual smile or the polite greeting he had grown used to. A few minutes later, the door to the office opened, and Dr. Gregory Jensen stepped out. He was a tall man in his mid-40s, wearing a white lab coat and a stern expression on his face. When he saw Snoop, his eyes narrowed, but his demeanor remained professional. At least on the surface. "Snoop Dogg?" Dr. Jensen called out, his voice cold and impersonal. Snoop stood up and walked toward him, offering a casual smile. "Yeah, that's me," he said, extending his hand for a handshake. But Dr. Jensen didn't move to shake his hand. Instead, he glanced briefly at Snoop before turning his back and walking toward the office door. "Follow me," he said curtly, his tone lacking any warmth. Snoop followed, trying to shake off the odd feeling that had crept into his chest. He had been to plenty of doctors over the years and had always been treated with respect. But there was something about Dr. Jensen's demeanor that made him uneasy. As they entered the examination room, Snoop took a seat on the table, waiting for the doctor to begin the routine examination. Dr. Jensen stood by the door, writing something on his clipboard, his back turned to Snoop. The silence stretched on, and Snoop could feel the tension in the air. Finally, Dr. Jensen turned around, his face expressionless. "I'm sorry," he said, his voice dripping with condescension. "I don't think I can treat you today." Snoop's eyebrows furrowed in confusion. "What do you mean?" he asked, his voice calm but tinged with disbelief. "I'm here for a checkup. I've got an appointment." Dr. Jensen's eyes met his, and for a moment, there was an unsettling flicker of something in them, something that resembled disdain. "I don't treat people like you," he said, his words slow and deliberate. The words hung in the air, and Snoop's mind raced as he tried to process what was happening. He had been to a lot of places, had encountered plenty of people who didn't understand him or who made assumptions about him based on his appearance, but this was different. The way Dr. Jensen spoke, the way he looked at him, it wasn't just about being dismissive. It was something deeper, something more sinister. Snoop's heart began to race. He had faced racism throughout his life, but he had never expected it to be so blatant, especially in a medical setting. He wasn't sure if it was the doctor's personal bias or something more systemic, but one thing was clear, he wasn't going to sit back and let this slide. "Are you saying that you won't treat me because of the color of my skin?" Snoop asked, his voice calm but firm, a trace of disbelief still present. He was trying to keep his composure, but the situation was unsettling. Dr. Jensen crossed his arms, his lips curling into a dismissive smirk. "I don't believe people like you should be treated by someone like me," he said, his tone dripping with arrogance. Snoop felt a surge of anger rise within him. He had encountered prejudice before, but never from someone who was supposed to be a professional. He had always believed that doctors were supposed to care for their patients, regardless of who they were or where they came from. He stood up from the examination table, his calm demeanor slowly shifting. "You've got to be kidding me," he said. "This is unbelievable." The doctor remained unmoved, his cold expression showing no remorse or hesitation. "It's not personal," Dr. Jensen said, almost as if trying to justify his actions. "I just don't want to waste my time with someone who won't take care of themselves properly." Snoop's mind was racing, but he knew that getting into a confrontation wouldn't help anyone. Instead, he pulled out his phone, opening the camera and recording the exchange. "You're saying you're refusing service to me because of my lifestyle?" Snoop asked, keeping his voice steady but sharp. "Because I'm a rapper? Because I'm successful? Because of the color of my skin?" Dr. Jensen's face reddened as he realized that Snoop was recording the interaction. "You're out of line," the doctor spat, his voice rising. "You're just trying to make this a race issue?" Snoop shook his head, his eyes narrowing. "No, Doc. You're the one making it a race issue. You're the one refusing service, and you're the one acting like I'm not worthy of care just because of who I am." The tension in the room was thick. Dr. Jensen seemed to be caught between his arrogance and his growing realization that he had crossed a line. But Snoop wasn't finished. "I'm done here," Snoop said, walking toward the door, still holding his phone. "But you should know this. I'll make sure the world knows what you did here today." As he stepped into the hallway, he quickly made his way to the receptionist's desk, where he informed her that he would be filing a formal complaint against Dr. Jensen. The receptionist looked uncomfortable, clearly not wanting to get involved in the situation, but she reluctantly agreed to document his complaint. Snoop walked out of the office, still feeling a mix of anger and disbelief. The situation had shaken him in a way that he hadn't expected. He had been to countless doctors in his life, and never once had he encountered something like this. But he wasn't going to let it slide. He immediately posted a video of the interaction on social media, sharing it with his millions of followers. Within minutes, the video went viral, spreading like wildfire across the internet. Fans and fellow celebrities alike expressed their shock and outrage at Dr. Jensen's behavior. Messages of support flooded Snoop's social media accounts, with many applauding him for standing up against the injustice he had experienced. The backlash against Dr. Jensen was swift and overwhelming. People from all over the world condemned his actions, calling for him to be held accountable. Within hours, the medical board received an avalanche of complaints, demanding an investigation into his conduct. But what happened next shocked everyone, including Snoop. The medical board acted quickly, launching a full investigation into Dr. Jensen's behavior. Within days, they released a statement confirming that Dr. Jensen had been suspended indefinitely while they reviewed the matter. The investigation revealed that Dr. Jensen had a history of discriminatory behavior, with multiple complaints filed against him over the years. His refusal to treat Snoop Dogg was just the latest in a long line of incidents. As the news spread, Dr. Jensen's medical practice was hit with a wave of negative publicity, and many of his patients began to seek treatment elsewhere. His reputation was irreparably damaged. But the real shock came when Dr. Jensen was officially stripped of his medical license. The board determined that his actions had violated ethical guidelines and constituted a breach of trust, not just with Snoop Dogg, but with all of his patients. Snoop, for his part, continued to use his platform to raise awareness about the issue of racism in healthcare. He called for reforms to ensure that all patients, regardless of race, background, or profession, were treated with the respect and dignity they deserved. "This isn't just about me," Snoop said in a follow-up video. "It's about everyone who's been discriminated against by people who are supposed to help us. This is bigger than one doctor. It's about making sure this doesn't happen again." The situation was a wake-up call for the medical community, highlighting the need for greater accountability and awareness of bias in healthcare. Snoop's bravery in sharing his experience not only sparked a conversation about racism in medicine but also empowered others to speak out about the mistreatment they had faced. Dr. Jensen's fall from grace was swift, but the message that Snoop sent was clear: no one, no matter how powerful or influential, was above being held accountable for their actions. And for Snoop Dogg, standing up to injustice wasn't just about his own experience, it was about ensuring a better future for everyone. The fallout from Dr. Gregory Jensen's actions continued to ripple through the healthcare community. His license had been revoked, and the medical community had been put on notice about the consequences of discriminatory behavior. But the most significant change came in the form of a broader conversation about racism in medicine, one that had been long overdue. Snoop Dogg's decision to speak out had sparked an awakening. His viral video, which showed the doctor's blatant refusal to treat him based on race and class, had become a catalyst for widespread discussions about healthcare equity. Snoop's fame and platform had allowed him to shine a light on an issue that often went unnoticed, or worse, ignored. His courage in the face of the doctor's refusal had brought thousands of voices into the conversation, voices of people who had suffered in silence, who had faced bias in medical institutions, and who had felt powerless. In the weeks that followed, news outlets, health organizations, and advocacy groups began to address the systemic issues that had been exposed. Medical professionals took a hard look at their own practices, realizing that while medical knowledge was universal, biases could creep in, affecting the quality of care that patients received. While some people were resistant to these changes, many understood that the problem wasn't just about one rogue doctor. It was about a pervasive issue that needed to be fixed from the ground up. Snoop's involvement in the movement didn't end with his post on social media. In the months that followed, he became one of the loudest advocates for reform in healthcare. He started working with organizations dedicated to ensuring that healthcare was accessible and unbiased, particularly for people of color. He used his influence to push for changes in medical training, calling for doctors to undergo anti-racism training and implicit bias education, so that future generations of healthcare providers would be more attuned to the subtle biases that could affect patient outcomes. But it wasn't just about institutional reform. Snoop's work had a deeply personal impact on the lives of many individuals. He started visiting hospitals, not just to raise awareness, but to directly engage with patients and healthcare providers. He listened to the stories of patients who had been denied care or mistreated because of their race, gender, or socioeconomic background. He met with nurses and doctors who were working on the front lines, trying to make a difference, and often struggling against a system that wasn't designed to support them. One particular moment stood out to Snoop. During one of his hospital visits, he sat down with a young black woman named Erica, who had experienced firsthand the discrimination that Snoop had spoken out about. Erica had gone to multiple hospitals for treatment but had been dismissed, misdiagnosed, or given subpar care simply because of the color of her skin. She shared her painful experiences with Snoop, explaining how she had been told by doctors that her concerns weren't as serious as others, how her symptoms had been downplayed, and how her pain had been ignored. As Erica spoke, Snoop couldn't help but feel the weight of her words. He had heard about this kind of discrimination before, but hearing it from someone directly affected by it was different. It was a stark reminder of why his fight for equality in healthcare was so important. "I can't even count the times they just dismissed me," Erica said, her voice tinged with frustration. "But it's not just me, you know? It's everyone who looks like me. We're treated like we don't matter, like our lives aren't worth saving." Snoop placed a hand on her shoulder, looking her in the eyes. "Your life matters, Erica. We're going to make sure it matters to everyone." This conversation with Erica, and others like it, solidified Snoop's mission. It wasn't enough to simply raise awareness. He needed to actively work to change the system. He teamed up with medical advocacy groups and pushed for legislation that would require all medical professionals to receive training on unconscious bias and cultural competence. He advocated for policies that would ensure equal access to healthcare, regardless of race or income. The public outcry from the video of Dr. Jensen's refusal to treat Snoop was just the beginning. In the months following the incident, several other cases of racism in healthcare were brought to light. Whistleblowers came forward, sharing stories of their own experiences with biased practices. In one case, a group of nurses revealed that they had witnessed doctors making racially insensitive comments during patient rounds. In another case, a patient's family shared how their loved one had been denied life-saving treatment because of the color of their skin. As these stories emerged, it became clear that the problem wasn't isolated to just one doctor or one medical facility. It was a systemic issue that had to be addressed at all levels. The healthcare system needed to change, and it needed to change now. Snoop's efforts didn't go unnoticed. He received widespread praise from fellow celebrities, activists, and politicians for his work in raising awareness about healthcare inequality. He had used his platform for much more than just music or entertainment. He had become a voice for the voiceless, a champion for those who had been denied the care they deserved. But Snoop's impact wasn't just limited to the headlines. In private meetings with policymakers, he pushed for reforms that would affect change on a national scale. He worked closely with healthcare reform advocates to draft legislation that would hold medical professionals accountable for discriminatory practices. His efforts led to the creation of a national task force dedicated to investigating and addressing racism in healthcare. The task force's work led to a comprehensive review of healthcare policies, practices, and training programs. Hospitals across the country began implementing new protocols to address bias and discrimination, and doctors were required to undergo annual training on cultural sensitivity and patient-centered care. The national conversation about healthcare inequality was changing, and Snoop was at the forefront of that movement. 1 year after the incident with Dr. Jensen, Snoop stood on stage at a national healthcare conference, addressing a room full of policymakers, medical professionals, and activists. His voice, once known for its smooth rap verses, now carried the weight of a message that was much bigger than music. "We've made some real progress, but we're not done yet," Snoop said, his calm demeanor masking the fire behind his words. "We've got to keep pushing for change, for the people who are still being left behind. This is about fairness. This is about justice. This is about making sure everyone gets the care they deserve." The audience erupted into applause, and for a moment, Snoop allowed himself to feel the satisfaction of knowing that his work had made a difference. He had taken a situation that could have been a personal humiliation and turned it into a national movement. He had used his platform to highlight the injustices that so many people had faced for years, and in doing so, he had helped bring about real change. But Snoop knew that the fight wasn't over. The medical field, like every other institution, was a reflection of the society that created it. Change, though necessary, was slow, and Snoop was prepared to continue his work for as long as it took. "Let's not stop here," Snoop concluded, his words resonating deeply in the room. "Let's keep working together to make healthcare a place where every person, no matter their skin color, no matter where they come from, feels like they matter. Because they do." As Snoop left the stage, he felt a sense of pride that he had never experienced before. He had been through the highs and lows of his career, but this work, this movement, was unlike anything he had ever done. It wasn't about the accolades or the recognition, it was about making sure that no one would ever have to face the kind of discrimination he had faced that day in Dr. Jensen's office. It was about building a future where every patient, no matter their background, could walk into a doctor's office and feel like they were valued, respected, and cared for. The fight was far from over, but for the first time, Snoop felt like they were on the right track. The future was bright, and he would keep pushing forward, one step at a time, for justice, equality, and dignity for all. As Snoop Dogg's movement for equality in healthcare continued to gain momentum, his influence began to spread into other aspects of society. His work was no longer confined to the hospital rooms and policy meetings. He was now part of a larger conversation about social justice, equality, and the responsibility of those in power to lift up the marginalized. Snoop's collaboration with civil rights organizations and activists led to a series of community outreach programs that aimed to educate the public about their rights when it came to healthcare. These programs weren't just about addressing the systemic issues in the medical world. They were also about empowering communities to take control of their own health. In many of the neighborhoods Snoop focused on, people had been systematically excluded from access to affordable healthcare or had been subjected to mistreatment and neglect. In these communities, Snoop became a figurehead for a larger push to improve healthcare access. He worked with health professionals to host health fairs, bringing essential services to the most underserved neighborhoods. From basic checkups and mental health screenings to seminars on how to navigate insurance and advocate for better treatment, Snoop was involved in every step of the process. He made sure that people not only got the care they needed but also understood how to take control of their own well-being. "We've got to fight on all fronts," Snoop said in an interview with a prominent news outlet. "It's not just about fixing the system. It's about giving people the tools they need to protect themselves, to stand up when they're being mistreated, and to be their own advocates. It's about empowering them." The work was tiring, but it was also incredibly rewarding. Snoop found that the more he engaged with these communities, the more connected he became to their struggles. He didn't just see himself as an outsider coming in to fix things. He saw himself as a partner in their journey. He wasn't just talking about change, he was part of the change. In the weeks that followed, Snoop's advocacy for healthcare reform began to attract the attention of larger organizations. Civil rights groups, healthcare professionals, and even politicians began to take note of his efforts. His platform had grown exponentially since his initial post about Dr. Jensen, and now he had become a key voice in the fight for healthcare equity. One of the major breakthroughs came when Snoop was invited to speak at a national healthcare summit, where he would be joined by some of the most influential policymakers and experts in the field. The summit was designed to address the growing disparities in healthcare access, and Snoop's speech was expected to be one of the central moments of the event. On the day of the summit, Snoop arrived at the venue with a sense of purpose. He had prepared a speech that would not only address the systemic issues within healthcare but also call on those in power to make meaningful changes. He knew that this was his moment to push for real, long-lasting change. As he stood backstage, waiting to take the stage, he couldn't help but reflect on how far he had come. Just a few months ago, he had been sitting in that doctor's office, denied service by a racist doctor who had viewed him through a biased lens. Now, he was about to stand before an audience of thousands, calling for justice for those who had been overlooked for far too long. The lights dimmed, and the crowd fell silent. Snoop walked to the podium, his usual calm demeanor replaced by a palpable sense of urgency. He took a deep breath, looking out at the sea of faces in front of him, many of them eager to hear what he had to say. "Thank you for having me here today," Snoop began, his voice carrying across the room. "I've been in this game a long time, but what I'm talking about today, it's different. This isn't about the music, it's not about the fame, it's not about the hustle. It's about something that's affecting people all over this country. It's about healthcare, and more importantly, it's about the people who have been denied access to the care they deserve." The room was silent as Snoop spoke, his words resonating deeply with everyone in attendance. He went on to discuss the issues he had encountered firsthand, the systemic racism in healthcare, and how it had led to substandard care for countless individuals, particularly in communities of color. "But this isn't just about pointing out the problems," Snoop continued. "We all know the issues. We've been talking about them for years. What we need now is action. We need to fix the system, we need to change the policies, and we need to make sure that no one, no matter what they look like, no matter where they come from, feels like they're less than human when they walk into a doctor's office." The crowd was rapt, and Snoop's message was clear. He wasn't there to be a celebrity. He wasn't there to get applause. He was there to speak truth to power and demand change. "We've got to start holding healthcare providers accountable," Snoop said, his voice rising with passion. "We've got to make sure doctors, nurses, and administrators are trained to treat everyone with respect, no matter who they are. We need universal access to healthcare, and we need it now." The room erupted into applause as Snoop finished his speech. It wasn't just because he was a celebrity, it was because his words carried weight. He had used his platform to speak on behalf of those who had been silenced for too long. His message was one of empowerment, hope, and most importantly, action. In the weeks that followed the summit, Snoop continued to advocate for healthcare reform on every front. His work in communities across the country had created tangible results. Health fairs, community outreach programs, and educational seminars were taking place in cities and towns where they had never been before. More people were gaining access to life-saving resources, and more voices were joining the movement for change. One of the most significant changes came in the form of legislation. A bipartisan bill aimed at addressing racial disparities in healthcare was introduced to Congress. The bill included provisions for increased funding for communities of color, expanded access to healthcare for underserved populations, and mandatory anti-racism training for medical professionals. While the bill still had a long road ahead, it was a major step forward in addressing the inequities that had plagued the healthcare system for decades. Snoop was invited to testify before Congress about his work with Project Unity and his advocacy for healthcare reform. The committee listened as he spoke passionately about the need for reform, his personal experiences with discrimination, and the stories of those he had met along the way. His testimony was compelling, and it helped sway several key members of Congress to support the bill. But despite the progress that had been made, Snoop knew there was still much to be done. The fight for healthcare equality was ongoing, and the battle was far from over. There were still far too many people who had been left behind, too many communities that lacked the resources to provide quality care for their people. "I've seen the change we've made, but we can't stop here," Snoop said during a rally in Los Angeles, his voice unwavering. "This is just the beginning. We've got to keep pushing. We've got to keep demanding better. We've got to keep fighting for the people who don't have a voice." His words were met with cheers, and for the first time, Snoop felt a sense of peace about the work he had undertaken. The road had been long and difficult, but he had made a difference. The movement was growing, and people were finally starting to listen. And as Snoop looked around at the crowds of people who had gathered to support the cause, he knew that the future was brighter than it had ever been. This fight was far from over, but he was ready for whatever came next. In the days that followed, the shockwaves from the video Snoop Dogg posted about his experience at Dr. Gregory Jensen's office continued to reverberate. The video had gone viral, drawing an outpouring of support for Snoop and widespread condemnation of the doctor's actions. People from all walks of life, fans, fellow celebrities, activists, and even politicians, began to demand accountability for Dr. Jensen's blatant display of racism. Social media platforms were flooded with hashtags like #JusticeForSnoop and #NoPlaceForRacism in healthcare, pushing the narrative forward in ways that were impossible to ignore. Snoop's followers rallied behind him, applauding his courage in sharing such a personal and painful encounter. But Snoop knew this was more than just about him. It wasn't about celebrity or the fact that he was a well-known figure. It was about the principle of equal treatment in healthcare for all people, regardless of race, background, or status. He had experienced firsthand what it was like to be judged based on the color of his skin, something that millions of people around the world faced every day. Snoop knew that, although he had the platform to amplify his voice, there were countless others who had suffered the same or worse without the ability to speak up. And so, with his platform, he continued to advocate for them. While the internet continued to buzz with outrage, Snoop worked with his team to prepare a formal statement that would further clarify his stance on the matter. His goal was clear. He wanted to use this incident to spark a national conversation about racial inequality in healthcare. "I'm not the only one who's been through this," Snoop said in a live broadcast to his fans. "I've had people reach out to me from all over, telling me their stories of being treated like they didn't matter. This isn't just about me or about one doctor, it's about a system that's been broken for far too long. It's about making sure no one else has to go through what I went through that day." Snoop's message was resonating with his audience. The more he spoke out, the more others felt empowered to share their own experiences. The #racism in healthcare became a rallying cry as more stories poured in from people who had experienced discrimination while seeking medical care. Some spoke of being dismissed by doctors, others about being denied treatment or given subpar care simply because of their race. But while the movement was growing in power, the response from the medical community was mixed. Some healthcare professionals immediately voiced their support for the fight against discrimination in healthcare, publicly stating their commitment to upholding the ethical standards of the profession. However, there were others who balked at the idea of institutional change, dismissing the outrage as a political or social trend rather than a deep-rooted issue that needed immediate action. As the debates raged on, the medical board launched an official investigation into Dr. Gregory Jensen's actions. It wasn't long before they discovered a history of complaints against him, all centered around biased behavior toward patients of color. Dr. Jensen, once considered a respected member of the medical community, was swiftly suspended pending further investigation. The backlash against him was swift and unforgiving. Public records from his previous patients showed a disturbing pattern. Several others had complained about being treated unfairly or being dismissed by him based solely on their race. But even as Dr. Jensen's career crumbled under the weight of his actions, Snoop and his supporters knew that this was only the beginning of a much larger battle. They needed systemic change in the medical field, not just the punishment of one doctor. Snoop took his advocacy a step further, collaborating with civil rights organizations and medical professionals to create a national campaign aimed at addressing racism in healthcare. This campaign, which came to be known as the Equal Care Initiative, sought to implement widespread reforms. The initiative focused on training healthcare professionals in cultural competency, requiring healthcare providers to undergo mandatory anti-racism training and education about implicit bias. Additionally, the initiative pushed for legislation that would hold healthcare providers accountable for discriminatory actions and ensure that underserved communities had access to the same high-quality care as wealthier neighborhoods. Snoop's dedication to the cause became even more visible as he worked tirelessly to bring attention to the Equal Care Initiative. He participated in panel discussions, spoke at rallies, and used his social media platform to continue spreading the message. He met with lawmakers and influencers, pushing for change in legislation and working to ensure that the fight against racism in healthcare was prioritized at every level. As the Equal Care Initiative gained traction, the media turned its attention back to Snoop's story, only this time, it was no longer about a viral video of a racist doctor. Instead, the focus shifted to the tangible impact that Snoop was having on a national scale. Despite all the attention, Snoop never lost sight of the larger picture. The cause wasn't about him or his fame, it was about creating lasting change and providing a voice to those who had been silenced for so long. However, not everyone agreed with his approach. Some critics, particularly those within the conservative media, dismissed his efforts as an overreaction or even accused him of exploiting the incident for personal gain. These voices argued that focusing on race in healthcare was a distraction from more important issues like healthcare reform in general, and that the problem of racism in healthcare was being blown out of proportion. But Snoop wasn't deterred. He understood that not everyone would be on board with his mission, and he knew that the road to change would be long and challenging. But he also understood that change rarely comes from silence. It came from the willingness to speak out, to confront injustice head-on, and to fight for what's right. A breakthrough came when the Equal Care Initiative was backed by several major healthcare organizations. Hospitals, insurance companies, and medical schools began to adopt the program, recognizing the importance of addressing racial disparities in healthcare. Medical schools integrated the training into their curriculums, and more hospitals began offering implicit bias workshops for their staff. Snoop's dedication to the cause culminated in a national rally where healthcare professionals, civil rights leaders, and patients who had suffered due to discrimination came together to advocate for systemic change. The rally, broadcast live across the country, saw thousands of people marching in solidarity with Snoop, demanding that racism be eliminated from the healthcare system. Celebrities, activists, and public figures rallied around him, lending their voices to the cause. The rally was a pivotal moment, not just in Snoop's journey, but in the larger movement to combat racism in healthcare. It became clear that Snoop had used his influence for something far greater than celebrity status. He had created a platform for people to speak out, for patients to be heard, and for change to take root. Months later, Dr. Gregory Jensen's medical license was permanently revoked. His case served as a stark reminder that discrimination in any form would not be tolerated. However, for Snoop and the millions of people he had inspired, this victory was not enough. It was just the beginning. As he sat down at home, reflecting on the long journey ahead, Snoop looked at his phone. Messages of support were still flooding in from fans, patients, and even fellow celebrities. His work was far from done, but for the first time in a long while, he felt like they were on the right path. The fight for equality in healthcare had only just begun, and he would continue to use his voice to demand a world where no one, regardless of the color of their skin, was denied the care and respect they deserved. Time for change, Snoop muttered to himself with a grin, ready for the battles yet to come. As the movement continued to gain steam, Snoop Dogg's role in pushing for healthcare reform expanded. The Equal Care Initiative had captured the attention of the nation, and Snoop's voice was one of the most powerful in the fight for racial justice in healthcare. But even with the immense support he was receiving, the battle was far from over. Snoop knew that his work wasn't just about spotlighting an individual case. It was about shifting the culture and dismantling the deeply rooted systems of inequality that persisted in healthcare and beyond. The Equal Care Initiative had now become a rallying cry, not just for the marginalized communities, but for medical professionals who were determined to be part of the solution. Snoop's initiative called for doctors and healthcare providers to undergo rigorous training on cultural competency, anti-racism, and inclusivity. The training program was soon being implemented in medical schools across the country. It became mandatory for all healthcare workers, from nurses to physicians, to complete these courses before being licensed to practice. But as the initiative gained traction, opposition began to rise. Some medical institutions, particularly those with deep ties to historical practices that had marginalized certain communities, were reluctant to make changes. They argued that the training was unnecessary, that there were already guidelines in place that addressed racial discrimination. But Snoop, having faced racism firsthand, wasn't buying it. He was determined to make the point that superficial reforms were not enough. Real change required dismantling the biases built into the system itself. To make his case, Snoop began hosting roundtable discussions with healthcare professionals, activists, and patients. These discussions became public forums where people could share their stories of racism and discrimination in the healthcare system. For Snoop, these stories were powerful tools, proof that the problem wasn't just a few isolated incidents but a widespread issue that needed to be confronted head-on. One day, as he prepared for a roundtable in Los Angeles, Snoop reflected on how far the movement had come. What had started as a viral moment of outrage had evolved into a national platform. He had turned his anger into action, channeling his frustration into something productive and positive. He knew the work wasn't easy, and the system wasn't going to change overnight, but he was seeing results. And that, in itself, was enough to keep him going. Today's roundtable will be different, Snoop said as he paced around his home office, preparing his thoughts. I'm bringing real voices to the table, real stories from real people who have had enough. And we're going to make sure the whole world hears it. As he walked into the roundtable event later that afternoon, Snoop saw a diverse group of people sitting at the table: doctors, patients, healthcare advocates, and civil rights leaders. The conversation was about to get raw. One of the first to speak was Dr. Alice Green, an African-American doctor who had worked for years in underprivileged communities. She was tired of the battles she had fought, both as a physician and as a woman of color in a system that often dismissed her patients' needs. I've seen it all, Dr. Green began, her voice steady but filled with emotion. I've had patients who came to me with their issues only to be told you're fine or it's all in your head because the system doesn't see them. We need to listen, and we need to change how we're trained. We need to understand that someone's race, their history, and their environment affect their health in ways we can't ignore. Snoop nodded in agreement, knowing that Dr. Green's words echoed the experiences of countless others who had been denied care or misdiagnosed simply because of their race. He turned to the next person at the table, James Turner, a patient who had spent years struggling to get adequate health care for his chronic condition. James had been turned away multiple times by different doctors, told his condition wasn't serious enough, or that he was overreacting. Getting the care I needed felt impossible, James said, his voice thick with frustration. I went to different hospitals, different doctors. No one would listen. And then I found a clinic that actually took the time to understand me. But it shouldn't be that hard. Why should anyone have to fight just to be heard? The group nodded, some of them with tears in their eyes as James spoke. It was clear that everyone in the room had faced similar struggles that were rooted in biases and systemic inequalities. Snoop felt the weight of it all, but he also felt the fire to keep pushing for change. Exactly, Snoop said, standing up and addressing the room. This is why we're here. This is why we can't stay quiet anymore. It's not just one person, one doctor, or one hospital. It's a system that's built on unfairness. And the only way we're going to change it is by raising our voices, standing together, and demanding action. The room was filled with a sense of solidarity as people shared their stories. The conversation moved from individual frustrations to collective action, and by the end of the roundtable, everyone at the table agreed to push forward with a series of concrete steps aimed at transforming the healthcare system. Snoop's involvement in the roundtable wasn't just symbolic, it was a game changer. He had the power to draw attention to the issues at hand, and he was using that power to force the conversation into the public eye. He made sure the discussions were broadcast, so that the voices of those who had been marginalized could be heard. But this was just the beginning. The work didn't stop after one roundtable discussion. Over the next several months, Snoop continued to use his platform to advocate for changes in healthcare policy. He worked with state governments, nonprofits, and medical organizations to establish initiatives that would ensure equal access to care for all patients, regardless of race, gender, or socioeconomic status. He pushed for more funding for community health centers in underserved areas, knowing that these centers could provide essential care to people who otherwise had no access to medical treatment. Snoop's efforts reached new heights when he organized a nationwide healthcare rally in Washington, D.C. Thousands of people gathered in the nation's capital, with prominent healthcare leaders, civil rights activists, and patients joining Snoop to demand justice. The rally was both a call for immediate reforms and a demonstration of the growing power of grassroots activism. As Snoop took the stage, the energy was electric. "I'm here for the people," Snoop began, his voice carrying through the massive crowd. "I'm here for the folks who've been treated like they don't matter. I'm here for the people who've been turned away, ignored, and dismissed. We're all in this together, and we're gonna make sure our voices are heard." As Snoop continued, he spoke about the need for systemic change, about the inequities that still existed in healthcare, and about the power of unity to bring about real reform. The rally was a massive success, and soon, Snoop's message was heard across the nation. But the real impact came when lawmakers began to take notice. Soon after the rally, several members of Congress introduced legislation that addressed racial disparities in healthcare. The bill called for the establishment of national standards for anti-racism training in medical schools and required hospitals and clinics to implement policies that would ensure equal treatment for all patients. Though the road ahead would still be long and filled with resistance, the progress Snoop and his supporters made was undeniable. Change was happening, and it was happening because people, ordinary people, had decided to speak up. For Snoop, the fight was personal. He had faced discrimination his entire life, both in and outside of the healthcare system. But he was no longer just a celebrity fighting for the cause. He was an advocate, a leader, and a symbol of the power of standing up to injustice. As the years went on, the Equal Care Initiative became a cornerstone of Snoop's legacy. The healthcare reforms that were introduced began to take effect, improving the quality of care for millions of people who had been denied treatment due to systemic bias. Snoop's tireless work not only changed the lives of countless individuals, but it also served as a reminder that one person with the right platform and the right conviction could truly change the world. And as he reflected on the journey that had started with a simple act of bravery in that doctor's office, Snoop Dogg knew that the fight for justice, whether in healthcare or anywhere else, was far from over. But the victory, for him, wasn't just about the battles won. It was about the lives saved, the voices heard, and the future that was now within reach for everyone. As the years passed, the Equal Care Initiative continued to evolve, and Snoop Dogg's role as a leading voice in the movement for racial equity in healthcare grew even more significant. What had started as an isolated incident of discrimination in a doctor's office had become a nationwide movement, and its impact was being felt at every level of the healthcare system. But while Snoop's efforts had led to undeniable progress, the journey was far from over. The issue of healthcare inequality remained persistent, and Snoop, now seen as one of the most influential figures advocating for change, was determined to push forward. In a society where systemic issues often took years, or even decades, to change, Snoop understood that the fight for justice wasn't a one-time win, it was a long-term commitment. He'd already witnessed the beginnings of change, but he knew the work required more than just public speeches and policy reform. It required real, on-the-ground action. One of the key areas Snoop focused on in the following years was expanding the conversation beyond just racism in healthcare to include broader issues like mental health care, access to care in underserved communities, and the importance of community-based healthcare. These were areas that Snoop had not initially planned to focus on when he began advocating for healthcare reform, but he quickly realized how interconnected they were with the overall mission. Snoop began working closely with mental health organizations, advocating for improved access to mental health services in marginalized communities. For far too long, mental health had been stigmatized, and for communities of color, the lack of culturally competent care often made it even more difficult for individuals to seek help. He knew that access to mental health services was just as critical as access to physical health care, and he was determined to make sure people understood the importance of caring for their mental well-being. "We've all been through a lot," Snoop said in a televised interview. "But we can't keep ignoring our mental health. We're not just talking about physical treatment, we're talking about the mind and the soul. For too long, people of color have had to suffer in silence. That's gotta change." Snoop's words resonated with a generation of people who had seen their mental health struggles dismissed or minimized. In the wake of his advocacy, local mental health centers in low-income and predominantly Black communities began to see an influx of people seeking therapy and treatment. Social media campaigns encouraged individuals to talk openly about their struggles, breaking down the stigma that had previously surrounded mental health in these communities. Snoop's collaboration with mental health organizations helped bring about legislative changes that made mental health care more accessible for uninsured and underinsured individuals. States that had previously neglected the need for mental health resources began allocating more funding toward the issue. Hospitals and clinics started implementing mental health screenings as a part of routine care, and medical professionals were trained to recognize the signs of mental illness in their patients. Though it was a monumental shift, the battle wasn't without its challenges. Snoop faced opposition from groups who still felt that the focus on mental health care was an unnecessary luxury, arguing that physical health needed to take precedence. Snoop, however, remained steadfast in his belief that mental health was just as important as physical health. His platform became a critical vehicle for spreading this message, and soon, mental health became part of the larger conversation about racial inequality and healthcare reform. Meanwhile, the Equal Care Initiative was making strides in its other areas as well. Snoop's advocacy for better access to healthcare in underserved communities resulted in new policies that provided financial support to community health centers. These centers were instrumental in providing basic care, preventive services, vaccinations, and routine checkups to people who otherwise would have had to go without. A major milestone came when Congress passed the Health Equity Act, a piece of legislation that Snoop had championed, which established funding for community clinics, universal healthcare access, and mandatory diversity training for medical professionals. It also mandated that healthcare providers report any complaints related to discrimination, with strict penalties for those who violated patient rights. The passage of the Health Equity Act marked a significant victory, but Snoop knew that real change wasn't measured by a bill, it was measured by how the policy affected the lives of real people. To ensure the effectiveness of the law, Snoop worked closely with government agencies to ensure that the changes would be implemented properly. He partnered with organizations that monitored the quality of healthcare services in underserved areas and worked to hold providers accountable for offering quality care to all patients, no matter their background. Despite the progress, however, Snoop was keenly aware that inequality in healthcare couldn't be solved with a single bill. He knew that the problem was deeply embedded in the culture of healthcare, in the way policies were structured, and in the way the medical community interacted with marginalized populations. His work wasn't just about reforming policy, it was about changing hearts and minds. Snoop's continued involvement in healthcare reform earned him respect from unexpected quarters. While his activism was often met with praise, it also came with criticism from those who felt that he was stepping outside of his role as an entertainer. Yet, Snoop never wavered from his commitment. He had seen firsthand how people were suffering, and he couldn't sit back and let that continue. He became a trusted voice for those who had been ignored, amplifying their stories and using his platform to ensure that the fight for healthcare equity remained in the public eye. He knew that change wouldn't come easy, and that there would be moments when things would get difficult. But those moments were part of the process. After all, real change wasn't easy. It was hard, it was messy, and it was ongoing. As part of his broader efforts, Snoop began to collaborate with other major figures in entertainment and sports to launch a series of benefit concerts and charity events, which raised millions of dollars for healthcare initiatives. He also worked closely with other celebrities, activists, and even politicians to continue pushing the conversation forward. Through all of this, Snoop's message remained the same. Equality in healthcare isn't just a dream, it's a necessity. One day, after a particularly successful event that raised significant funds for community healthcare, Snoop sat down for a quiet moment at his home. His journey had taken him from a rap icon to a leading figure in social justice, and as he reflected on his path, He thought about the incident at Dr. Jensen's office, how that one moment had ignited a fire in him that he had never anticipated. "I didn't think this was where my journey would take me," Snoop said to himself, his voice thoughtful. But here we are. It was true. The road he had taken was unexpected. But what mattered was that it had led to real, lasting change. And that, in Snoop's eyes, was the ultimate measure of success. "Sometimes, you've got to take a stand," he continued, reflecting on everything he had accomplished. "You've got to be the voice for those who can't speak for themselves. And when you're in a position to make a difference, you have to do it." With a sigh of contentment, Snoop looked out over the city, knowing that his work was far from done. There was more to fight for, more to achieve. But now, more than ever, he knew he was on the right path. He had helped expose a deeply ingrained problem, and in doing so, he had created a path for change. Snoop Dogg's advocacy for healthcare equality wasn't just about him. It was about everyone who had been silenced, everyone who had been denied care, and everyone who still didn't have access to the basic resources they needed to thrive. Through his work, he had shown that even the most famous stars could stand up for justice, and that change, however difficult, was possible when people came together and refused to accept the status quo. And as he continued to fight for equity in healthcare, Snoop knew that this was his greatest legacy. Not his music, not his fame, but the lives he had touched and the difference he had made in the world.